welcome to the deep dive. Today, we're getting into something, well, incredibly important, but maybe not talked about enough. Diabetic eye care.
It's vital, yeah.
Absolutely.
Yeah.
And here's a startling fact to kick us off. Diabetes is actually the #1 cause of blindness in working-age adults.
That's right. Sobering statistic.
But here's the thing, most of that vision loss, it's preventable. So this deep dive is really your shortcut to understanding how you can protect your sight. Basically prevent damage that you just can't reverse.
And the danger often starts silently. That's the key thing. No symptoms at first.
Exactly. So let's unpack that silent threat. How does high blood sugar actually start causing problems in the eyes?
Well, think about sustained high blood sugar. It damages the tiny, delicate blood vessels all over your body.
Okay.
And the eyes are particularly vulnerable. You know, they have lots of these tiny vessels. This damage leads to conditions like diabetic retinopathy.
That's the damage to the retina's vessels.
Precisely. And also diabetic macular edema, which is fluid building up in the macula, the part responsible for your central sharp vision. And what's really crucial to grasp and get is that these often start completely silently.
No warning signs.
None. So irreversible damage can actually be happening before you notice any blurriness or dark spots in your vision.
Wow. And it's not just retinopathy we need to worry about, is it? I read the risks for other conditions go up too.
That's absolutely right. If you have diabetes, your risk of developing cataracts, that clouding of the lens, basically doubles. It happens at twice the rate.
Twice the rate.
Yeah. And there's also a significant, like a 40% higher risk of developing glaucoma. That's where pressure inside the eye can damage the optic nerve.
Okay, so this silent damage, these increased risks, it all points back to needing checks even without symptoms. So what are the actual guidelines? When do people need these exams?
Good question, because timing is everything for early detection. For type 1 diabetes, the first big, comprehensive dilated eye exam should happen within 5 years of diagnosis.
5 years, okay.
And then annually after that. For type 2 diabetes, it's different. You need that exam immediately when you're diagnosed.
Right away.
Right away, and then annually. And pregnancy adds another layer if you have diabetes. An exam before conception is ideal. If not, then early in the first trimester.
And then ongoing checks.
Yes, monitoring usually every trimester, and sometimes up to a year after delivery, too.
That's quite clear. But what about someone who says, you know, my A1C is great, my blood sugar's under control. Do they still need that yearly check?
That's a common thought, but a risky one. Precisely because those early stages are silent. Good control is fantastic. It reduces risk significantly, but doesn't eliminate it.
Right.
Now, if someone has consistently excellent blood sugar control and absolutely no signs of retinopathy on their exams year after year, their eye doctor might say, okay, maybe every 1 to 2 years is sufficient.
But only if the doctor advises that.
Absolutely. Any sign of retinopathy, even mild, means you're back to at least annual exams. And thankfully, things like retinal photography and even AI-powered screening are becoming more common, which helps with access.
So let's talk about the exam itself. What actually happens during a comprehensive diabetic eye exam? What should you expect?
Okay, well, you'll have the standard vision test, reading the chart, but the really critical part is the dilated exam.
Those eye drops.
Exactly. They widen your pupils, which lets the doctor get a really clear, wide view of your retina at the back of the eye. They're looking for any changes to those blood vessels.
That makes sense.
They'll also check the pressure in your eyes for glaucoma, and often they'll use something called OCT imaging.
OCT.
Optical coherence tomography. It uses light waves, basically, to take incredibly detailed, cross-section pictures of your retina. Very useful for spotting swelling or other issues early.
Got it. Okay, practical tip from me then. Definitely bring sunglasses for afterwards.
Yeah.
And maybe get a ride home.
Oh, good advice, yeah.
Because that dilation makes you super light sensitive, and your near vision gets blurry for a bit. You won't want to be driving right after.
Definitely not.
But while that blurriness is temporary, there are some vision changes that are not okay to wait on, right? What are the urgent warning signs, the red flags where you need immediate help?
Yes, absolutely critical. Don't wait for your next scheduled appointment if you experience any sudden changes in your vision.
Like what specifically?
Things like suddenly seeing lots of new floaters, those little specks drifting around, or flashes of light, or if you see a dark curtain coming across your vision.
Okay, that sounds serious.
It is. Also, severe eye pain, seeing halos around lights, or sudden double vision, any of those warrant immediate medical attention. Call your eye doctor or head to emergency care right away.
Don't delay. Got it. So beyond exams, let's shift to prevention and managing risk. You mentioned duration matters.
Hugely. The longer you've had diabetes, the higher the risk. That cataract risk, for example, it jumps significantly, like over 5 times higher after 10 years with diabetes.
Wow. But control helps mitigate that, right? You mentioned the A1C.
Yes, massively. Think of it this way. Every single percentage point you lower your A1C, that average blood sugar measure, you significantly reduce your risk of developing or worsening retinopathy. It's a direct link.
That's powerful.
It really is. And studies even show that people who understand why these eye exams are important are actually more likely to have better blood sugar control and get their regular exams. It connects.
So awareness drives action.
Yeah.
What are the key day-to-day defensive actions then?
It boils down to the fundamentals of diabetes management, really. Maintaining the best possible blood sugar control you can. Managing your blood pressure, that's also crucial for vessel health.
Right.
Don't smoke. Smoking is terrible for blood vessels everywhere, including the eyes. Get regular exercise. And take all your medications exactly as prescribed.
And what about the barriers? People sometimes say, well, I don't have symptoms or it's too expensive.
We hear that. The no symptoms reason is dangerous, as we've discussed. For cost, most insurance plans actually cover annual diabetic eye exams because they know how critical prevention is.
Good to know.
And if getting to the doctor is physically difficult, it's worth asking about mobile screening options or telehealth consultations that might be available in your area.
And there's hope, even if problems are detected, isn't there? Modern treatments.
Absolutely. If caught early, treatments like anti-VEGF injections, these help block the growth of leaky abnormal blood vessels, or laser therapy to seal leaks, or even steroid treatments can often stabilize vision and sometimes even improve it. But again,
Early detection is key.
early detection is everything for these treatments to be most effective.
So bringing this all together, the stark reality is that less than half of people with diabetes are getting the recommended eye care.
It's a huge gap, a massive missed opportunity for preventing blindness.
So the clear message for you listening has to be, take this seriously. Your vision is just irreplaceable.
Yeah, I mean, the question really is, are you doing everything you can? Schedule those comprehensive eye exams based on the guidelines we talked about. Work hard on that blood sugar control.
Know the warning sign.
Know those red flags, definitely. And crucially, please don't wait for symptoms to show up. Act proactively.
Because your ability to see impacts absolutely everything: your independence, your work, your quality of life. Regular eye exams and good diabetes management truly can preserve your sight for life. Early detection saves sight. It's as simple as that.